You can also call me Dr. Scalpel Artist. Today I'm going to teach you how to do the sutures in the wound which is having the angle, okay, or you can say the corner. Now look here, suppose for example here you are having 3-4 few wounds are there which is having the angle in it, understood? So most probably or mostly we use what is called horizontal mattress in these things, right? So that is why it is also called as mattress suture in the angular wound. Now here you are having the angles, so there are certain things are there which should be considered. If we consider that, we will be easily and perfectly approximating the wound edges all around, even in the angles also, understood? But if we don't consider properly, what is going to happen, these areas, the wound edges will be approximated to each other, even these areas will be approximated, but the exact angle or the corner, we can say, in these corners it is not approximated, leading to chances for infection as well as scar. So let me explain here. Now look at here, I have drawn the angular wounds. So here what we are going to do, before doing the suture you should just imagine a imaginary line here. So what are those? Now look here, one should be exactly passing through these corners, understood, as well as another should be passing along this one. Am I correct? So when you are taking the bite, if you are taking a bite in these areas, what is going to happen, these areas are going to be approximated to each other, but this area will still remain unapproximated. So chances for gap in between the wound edges are there, or chances for the appearance of dog's ear can happen, particularly in this part. Am I clear? So to prevent that, what we are going to do, we will take a x distance from this imaginary line, x distance from this imaginary line, and here we will have a x distance from this imaginary line, and from this edge we will have a x distance. So this is the point, these are the points. Similarly here we are having, so here are the points where we are going to take the bite. Now let us talk about this one. Now here what is going to happen, similar thing, let me draw the imaginary line here. Similarly here we will be drawing and the imaginary line, okay? So here also we will not take a bite in these areas, neither will be driving out from these areas. So what is the best thing is that we will be taking x distance from this edge and x distance from this imaginary line. On this part, x distance from this imaginary line and x distance from this this edge, sorry, understood? So similarly here also we will be doing the same thing, here also the same thing. So these are the points, look at here, understood? So if you do in this way, what is going to happen is that, what is the benefit is that even the angles will be closed properly, or else only these areas will be closed but angles will not be closed. So let me demonstrate and show you. Let's come back here. So here what I'm going to do, I'm going to take a just one bite here, clear? So this is the bite, I'm driving the needle out. Now after this, exactly in front of this, again I'll take a bite, but I'll be coming out x distance away. Am I right? Got this much? Now look at it, I'll reverse the needle as it is a horizontal mattress. Now I'll be taking the bite exactly in front of this and from this imaginary x distance. So let me take a bite here. Similarly here also we'll be taking the bite. Now after this we are going to tie the knot. Let's try to concentrate properly. Here again we'll be using the tip to tip technique, and here look here, now I have approximate. Can you see? Look at here, even these angles, this area is also closed. Now look at here, look properly, okay? Now let me go for anti-clockwise. So this is what is the horizontal mattress in the angular wound, or you can say mattress suture in the angular wound. This much clear? Now how to remove it? Before removing, let me explain you about these areas. Look at here, can you see still these areas are not approximated at all, right? So here you are having opportunity to do the suture. Simple interpret you can do what is called horizontal mattress or vertical mattress, depending on the types of the wound or thickness of the tissue, etc. Understood my point? So now let me remove this suture and explain you. So just hold it, just below the knot you are going to cut it. Again, don't pull it. Now this part also you'll be cutting similar way as you have done for the removal of the horizontal mattress. Now hold this one and move towards the angle. This much clear. This is how you are going to do the horizontal mattress or mattress suture in the wound where you are having the angle or corner. Thank you.